Hi, I'm John Bermingham with the Board of Supervisors, and I'm sitting here with Dr. Raso. Dr. Raso, it's great to see you.
Thank you very much. I just want to tell you that my heart is full of joy with all the love and prayers that everyone has shown me. I can't just thank you all enough for supporting me during this tough time.
Yeah, Doctor, I received so many emails, messages. We had the drive-by video and everything. Great, great. So it has been a few weeks since we've been together, and many people know now the reason we haven't been together is because you've had the coronavirus. How are you feeling today?
I'm about 80 to 90% better. I'm not 100%. I would say that it really knocked me for a loop. When I went to the hospital that day, my oxygen levels were very low. I required oxygen. I was probably a little close to a ventilator at that point. They did give me remdesivir. They couldn't give me monoclonal antibodies because of my age, and they told me I wasn't fat enough. But let's not ask my wife that question.
So,
But it did work, and I was very happy.
good.
And the nurses at Lehigh Valley gave me excellent care.
That's great to hear. So, can you describe what your initial symptoms were, and when did you say, "Oh man, I might have the coronavirus. I need to get to a doctor or even the hospital"?
Well, my initial symptoms was a fever. I went and got tested, and it was negative. 3 days later, I still had a fever. I was retested, and it was positive. I felt reasonably well for the first 5 or 6 days. Then, as time went on, I noticed that my breathing was getting more shallow. It was difficult for me to walk. My legs were getting very heavy. I was in touch with an infectious disease specialist, and she finally said, please come to the hospital.
And you mentioned your treatment in the hospital.
Was remdesivir, vitamin D, Mucinex, believe it or not, and they gave me nebulizer treatments with albuterol.
Has your experience with the coronavirus changed your view on anything to precautionary measures, safety measures?
I think it's all the same safety measures, wearing your mask, washing your hands, keeping your distance. If you know someone who is sick, please try to stay away from them. If you do feel sick, you should stay away from everybody until you get tested. You know, I hate to say it, I lost quite a few patients in the last month or two due to coronavirus. All of them were older, but still our heart is breaking for them. So it is a very serious infection.
If one has had the coronavirus, should that individual relax a little and not be so concerned about getting?
You can relax because you should make antibodies. Now, according to the CDC, you cannot get the vaccination for 90 days. Now, some people are getting them earlier than that, but the CDC says 90 days.
Looking in hindsight, is there anything you would do differently now to prevent getting the coronavirus or others from getting the coronavirus?
Well, I believe the way I got it, if we do contact tracing, was somebody who basically fell into my arms coughing. And I think I didn't have glasses on, and I think it came through my eyes.
So it was while.
Your eyes can get it through your eyes also.
Do you believe it was while you were treating patients, or you're just not sure?
I think I was treating the patient came in from the hospital with COVID, and he wasn't doing very well.
Doc, a new coronavirus strain was detected in the UK shortly before Christmas, and I believe it is now reported to be here in the US.
I think there's about 5 to 7 cases right now. It's supposedly a little bit more aggressive, but the vaccination will work for that also. But the death rate has not changed with it. So basically, in some ways, it's just like the same Corona-19.
And that's
a little bit more aggressive. You can get sick a little quicker.
Okay, now that you've had the coronavirus, are you still going to take the vaccine?
Yes.
Okay.
90 days.
Okay. And what are the latest updates in cases here in Northampton County?
In Northampton County, we have almost 19,000 cases. If you remember, back in November, we had 4,000 cases. We have had 480 deaths. Mount Bethel has 140 cases right now. Back in November, we had 13 or 30. It was pretty mild. Yeah. Bangor has almost 700. Penargil has 268. So basically the Slate Belt has 1,000 cases of the 19,000 cases of Northampton County itself. And, we've had a lot of people die in the Slate Belt also. So it's a serious thing. We have to take it very seriously.
When do you see the numbers starting to go downward in the trend?
Oh, boy. That's the magic question. I don't see it happening for the next 4 to 6 weeks because we have to get more people vaccinated and we have to open up the vaccinations. Of course, now I think they're going to release all vaccinations, not wait for the second round because they were holding some back for the healthcare workers to get their second shot. I think what you're going to see is everybody who's 65 years and older are going to be the next group who get it very quickly.
Okay, and any updates on the vaccines coming here to Upper Mount Bethel?
Well, we're trying to contact with Lehigh Valley and St. Luke's to see if they can partner with us to get out here.
Okay.
Because right now, the vaccines have been paid for by the taxpayers.
Yeah. So, Doc, I have some resident questions. First question from a resident is, which current vaccine do you best support?
Well, if the Moderna and the Pfizer are both an interesting way of doing vaccinations, an mRNA, which tells your body to make an antibody to this virus. It's not like our normal way of doing things. It's only been out for this technology for about 10 years. Now, they're saying that they have 95% efficacy, which is very good. So I think, if you're a lucky one to get it now, great. There is another one coming out, the AstraZeneca, which is your classic flu shot type. And I would say if you're really concerned about the first two, because they're different, wait for the AstraZeneca. It's only going to be about 60 to 70% effective, but it should be fine.
Since multiple companies have made vaccines, what happens if you get one vaccine now, but a more effective one comes out later? Can you get more than one COVID-19 vaccine?
I believe so, yes. Because about 10 years ago, we came out with a shot for shingles. And it was a single shot. It was only 75% effective. Since then, we've come out with Spherynx, which is a double shot, and it's 97% effective. So most people who had the first one have gotten the second one, and they've had no problems.
So the Pfizer and the Moderna one, you said are about 95%?
Yeah, 95%.
What are your thoughts about the recovery rate to the coronavirus? Is it really a 90 to 95% recovery rate for those who get the coronavirus?
I think most people are going to recover. Some people are going to get some kind of chronic medical problem where they don't feel well, almost like fibromyalgia, because, we don't know everything about this. I mean, if you think about it, an 18-year-old got it in Chicago about 2 weeks ago, and in 5 days she expired. Her brain swelled up and she died. I've had patients who've had multiple blood clots from this coronavirus, which doesn't happen with the flu. So it's a little different in that sense, but I think most people will get it and will do fine.
And are you afraid of getting the coronavirus again since you see so many patients?
I'm a little less afraid right now because I have antibodies, so I'm a little more covered. But I am still practicing very safe stuff. I don't want it again, I can tell you that.
Doc, now are you back in the office seeing
Back
patients?
in the office, I started this week. I'm going kind of slow, taking it easy, because I've been yelled at by numerous women in my life. My wife being the primary one.
Sure. And will your office be vaccinated?
Well, we're hoping that we do get vaccinations. We're working that with Lehigh Valley.
Okay, great. Well, Doc, I just want to say it's great to see you.
I'm glad to be back.
And that we're thankful here in Upper Mount Bethel that you recovered and you're taking care of us again.
My pleasure.
Okay, thank you very much. Have a good day, and we'll be back in 2 weeks with our next update.